Dr. Cristi Bundukamara. Did I crush that?
Mm-hmm,
okay,
yep.
Perfect. Dr.
Proud
B.
of you.
I appreciate it. That was a tough one. But Dr. B,
Yeah.
I appreciate you coming on the Veterans Voice podcast. How's it going?
Pretty good. I'm excited to talk about grief, trauma, how it impacts veterans.
Yeah, for sure. When we were introduced, I kind of got a little bit of background about you. Whole new perspective on grief, something very relevant to the veteran community. And I'm very excited to learn from you because that's what this is going to be. So let's just start about your time in the military. You're a veteran yourself. How did that journey begin?
Started age 17 as an Army medic, went straight to Korea and spent about 3.5 years in as an enlisted, and then got out, went to nursing school, came back as an officer, and recently retired as a commander in the reserves.
Okay. What were some of your duty stations during that time?
Fort Benning and Camp Red Cloud in South Korea.
When were you at Fort Benning?
Oh, you were probably not even born yet.
Okay, never mind. I was stationed there for 6 years.
92.
Okay.
1992.
Yeah, I was stationed there for 6 years when I was EOD. That was a cool place. I liked it.
Yeah, in the middle of nowhere.
In the middle of nowhere. As long as you like the South.
Yeah.
Good barbecue.
Yeah.
But cool. It sounds like you had a pretty cool career. You have experience with grief, and I'll kind of just let you start where you feel is appropriate.
Yeah.
But I want to really just get to know your perspective of grief and then just ask you appropriate questions about it. So how did you start to experience grief in your life?
In 2005, I had recently adopted 5 children from the foster care system. They came to me with pretty significant trauma and abuse in their life, and I promised them that I will now take care of you.
Okay.
Like, you are protected. And I had 2 biological children as well, and we were on family vacation, and my son Johnny died in a drowning accident. And immediately, when someone dies that you love, that is close to you, you kind of go into shock, right? And so we think about these grief theories that talk about, denial and, bargaining and depression, and then eventually getting to acceptance. But none of that was a reality. The shock part was real, right? Like, you're in shock that this is happening to you, not in denial that it did happen. Like,
right.
you know this person is gone. But I didn't even have time to grieve. Shortly after that, about 6 months after that, my biological son, Reggie, started having catastrophic epilepsy. So he would have multiple seizures, no medications would work. His seizures were so bad that he actually would break bones, that they were so intense.
Wow.
And so there was 10 years of medical trauma that we experienced, hoping to save his life, hoping to save his life, hoping to save his life. That's actually what brought me to Colorado. In 2013, there was a big movement of children with epilepsy coming to Colorado to see if CBD oil, a type of cannabis, would stop their seizures. And so we moved in 2013 to try to save my son. He passed away in 2016. During this time, I'm a reservist. I am a psychiatric nurse practitioner. So I am experienced in hearing the trauma of other people. But when you're in the midst of it, you don't even know that you're experiencing trauma.
Right.
And we talked about this a little bit, going in to combat, you know you're going to experience trauma, but you don't think about what it's doing to you physically.
Right.
And so my trauma doesn't come from my military experience. It comes from my family, my life. And so 10 years of medical trauma, doing everything I can to try to save my son. And then he died in 2016. And still at that point, I would not admit that I had experienced trauma. I always think of trauma, or I used to think of trauma as like a victim stance, right? And I think people in the military, people who are, type A personality, proud, confident people, we don't want to admit trauma, right? Because it even though we're changing the stigma, internally there's still this admitting that something has happened to me. You can stop me at any time.
For sure.
With it.
All I was going to ask is, you're saying now you didn't understand that you were experiencing this pain or this trauma. Looking back today, can you see how you were actually changing?
Yes. And trauma changes you and grief changes you, right? And it wasn't actually until I got a brain scan when I did this grief documentary, and I went 45 straight days of grief. And in that documentary, I did a brain scan. And I thought, oh, well, maybe we'll see what grief is, what it does to the brain. And the doctor said, well, one, you look like you have a traumatic brain injury. And I've never had any kind of physical traumatic brain injury. And two, your amygdala is on fire, and your amygdala is where your trauma response. Mm-hmm. So I had been in chronic trauma for, by that time, almost 20 years of chronic trauma, that it was changing my brain chemistry. And I'm such a fighter, which most sailors and soldiers are, right? That is our personality.
Right.
So to admit, well, one, I had to admitted losing the fight, right? My son died in 2016, and then my daughter 5 years later. I had to admit that I'm not actually in control of much, right? And that this fight that I've been in is actually causing brain damage. And I'm a psychiatric nurse practitioner, and I help people with trauma all day. Like, that's what I do for a living.
Right.
But when it is yourself, I had to have a physical brain scan because I would, because we have this mindset, and we even teach it, like, positive mindset and just pushing through, and the whole self-development world, which is great content. But it's not really realistic, right? It's not just about thinking positive and pushing through. You need to actually process your trauma, or it's going to come out in physical ways.
Yeah, it's like we can't comprehend our own change in any way. You kind of see this in like high-performing individuals, and you see this in people who experience trauma and loss. It's like you don't comprehend that you're either improving or deteriorating. I wonder what's your perspective on that?
Well, I've been a self-development guru my whole life, right? Like, since I was a teenager, and like, how can I better myself? And reading these things, and I think the problem is it's skewed, right? We have the mental health community that says this is a disease, whatever mental illness or mental health condition you're struggling with is a disease state, and the self-development world is saying, none of that's a disease state. You can manifest whatever you want if you just think positive. They clearly have never been to war. They've clearly never experienced real trauma.
I was going to ask you what your answer is, but I think I got it.
Yeah. And so I'm trying to bring those two conversations together.
Right.
Yes, thinking positive is going to better your life in general, but not processing your trauma is going to negatively impact what you're trying to do with that positive.
Right. So how do we start? Like, objectively, you can look at your life. I can look at my life. You can look at your life. Anyone can look at their life. I've experienced a loss. I've experienced a trauma of some sort. How do you, A, consciously see that, and then B, understand how to start or where to even start or the reason to start?
Yeah. So we like to quantify trauma in our talk, and I want to discourage people from doing that.
How might someone quantify?
We'll say, oh, little T trauma.
Okay.
Your dad yelled at you when you were a kid versus watching your friend die, right? But if you have gone to war, even just going there, you've probably experienced trauma.
100%. I might die on the other side of this plane ride.
Right.
That's a traumatic thought.
Yes. And so acknowledging that, even if your friend or your colleague or someone has a bigger T trauma, then we often minimize ours, right? When I'm talking to veterans, I'm like, my trauma was not in combat, but I understand grief and trauma.
Right.
And I can teach you about processing grief and trauma. It doesn't have to be the same. And I don't want you to minimize your trauma because maybe you know people who have had bigger T trauma.
Right.
Because it's yours, and if you don't process it, it's going to impact you.
Right. Yeah.
So it doesn't matter if it, but we also don't want to ruminate and give attention to little T trauma,
right?
Where we're feeding into negative thoughts of woe is me, and I've experienced these horrible things. Great. You've acknowledged it. Now let's figure out how to release it rather than now we're going to feed into little T trauma and make it big T trauma.
Right. Yeah, for sure. Yeah, we all understand the emotion that comes with trauma. And like the military community is a salient example. I have friends who have 10 deployments, have physical scars. I don't have that many deployments, and I've never been shot. Mm-hmm. So like for me to sit here and say I have PTSD, like I feel like an imposter almost, but I know I have my experiences. But I think that was well said. As soon as you start to quantify your trauma, you've kind of lost touch with what you need to be doing. You need to be focusing on the emotion that comes with that trauma and understand that we're all feeling that. Just to get a little sidetracked, I think emotion is a universal language that we can all speak and we can all understand because you have your trauma, I have my trauma. And
but men don't speak emotion very well.
I'm trying to be an exception.
Yeah.
Because it's important.
It's important.
It's important.
And we know that, what I think 80% of the military is men. Mm-hmm. I think that's statistics, and I could be wrong. I'm just pulling that out of my head. But, it's hard to start having that conversation. Mm-hmm. But it is important. It is a universal language, and we can speak it, and it actually shows strength, not weakness.
Right. And the way we discover it is through conversation, through sharing our story. You understand trauma. I understand trauma. We both feel loss. We both feel pain. We both feel like we miss somebody. We all feel grief. Yeah. So maybe we could segue into this idea of traumatic grief, how to separate them, why they, coexist together, and just how to start working through it. Yeah. But let's first just understand this perspective because it's new to me.
Mm-hmm. When you have grief in your life, all grief, whether it's the normal, I lost my grandmother at 90, the reason that feels normal, one, it was expected. It happened in the natural order process, right? And you can be proud of your relationship and your life and cherish that, right? So it seems it's easier to go through that when it's in the natural order of things. Traumatic grief is anything that is out of order, traumatic in nature, so in war, in violence, so mass shootings, even horrible car accidents, right? The person is there 1 minute and then they're gone. And that creates a huge shift, right? Grief changes you. Trauma changes you. We talk a lot about trauma when we're talking to veterans because we know if you've been deployed, you have experienced trauma. We talk about grief like you lost your grandma. And you didn't just lose your grandma. You lost a battle buddy, maybe your best friend, the closest person to you. Or maybe there's these, enmeshed feelings of guilt, survivor's guilt, or guilt. Maybe there was an action that was taken prior to their death that you think if you would have changed, the outcome would have been different, right? These are all the things, that's trauma now enmeshed with your grief, now complicated by guilt, which is a negative thought, right? And it just all gets enmeshed. I like to think of it like, if you had all of these strings of, if life was so simple that every time you went through something hard, it was like this little stepping stone, and then you had another hard thing, but you got through them one at a time.
Right.
But that's not what happens in traumatic grief. All of that happened in a 6-month deployment, right? And maybe more than one time. And it all gets so that all those strings are all intertwined.
Yeah, enmeshed is the perfect word.
Yeah, and then maybe at home, the person that your spouse who is supposed to be there for you is frustrated in your deployment. Maybe, there's all kinds of stories of infidelity while, during deployment. Those are the things that break a soldier or a sailor, right? That, I knew what I was signing up for, but then the family thing, I can't take that. And I think that is the reintegration when you come home and the increased suicide rates, like that got all mixed up with what happened over there.
100%.
And, who am I? Am I a soldier or am I a father? Am I, a husband or am I a soldier, right? Like, and it just, like, we have to untangle that.
Right.
And one more thing on that.
Please. Grief
and trauma. Grief, to process grief appropriately, is a badge of honor. It is I lost this friend and I love them and I'm going to hold on to that pain as honor to him or her, or in my case, my kids, right? Whereas trauma needs to be released. Otherwise, it's going to cause physical damage to your brain and your body. When it happens together, we have to separate those things. But we also have to give permission. And this is why I don't like a lot of the grief theories that end in acceptance. I'm never going to accept that I've lost my children, right? Like, I'm going to see them again in eternity, and that's, we can talk about the spiritual conflict. But this idea that it's a stage and then it's over, right? So 5 years from now, you've been, home safe, quote unquote safe for, 5 years, and you're still have a knot in your chest or your throat or your stomach where you are holding this. Because you're not going to let go of the grief, but you haven't let go of the trauma either.
Yeah, and you might start to get angry at yourself. Like, why am I still feeling this? It still hurts. It still hurts. It still hurts. You're saying that this is normal.
Yeah.
But we need to start, we need to start compartmentalizing and, what's the word for like de-enmesh?
So compartmentalizing is a comfortable word, but probably not a good word. And I like to think of it like a file cabinet, right? So they talk about a compartmentalized brain as all of these little boxes. And this is, I think, what happens with PTSD. If you like your compartmentalized brain, you have never dealt with really processed anything. You just have them nicely in little boxes and you can function. But then everybody has a point where the compartmentalized brain does not work anymore.
Okay. You just completely blew my mind because compartmentalized is a comfy word. I use it all the time. But now I'm understanding compartmentalizing is step one. Processing each compartment is step two.
Right.
Wow.
But typically when you compartmentalize,
we can end the podcast there. Just kidding.
You like to keep it in the box because it's safe, and people are scared to open Pandora's box because it's messy. And so I like to think of it as a file cabinet, like the old school file cabinets where the top is open. You have all of these folders. They're labeled. You know what they are. You bring them out and feel the pain. So I started this thing I called controlled grief when my son died in 2016. And it was literally just taking the time to feel the pain. And we don't do that. We're like, well, the grief theories say if you're still grieving after a year, then it's prolonged grief disorder. Well, it's not. Like, grief is forever. Like, even my grandmother, who I lost at an appropriate age, like, when I think of her, I still tear up a little bit, right? Like, so grief is forever. The intensity and frequency in which you have to feel it should decrease if you're doing it properly. But holidays are coming, right? This grief always comes to the surface in holidays.
For sure.
Whoever, loved one that you have lost. But the trauma, there's a book called The Body Keeps the Score. Have you read it?
I own it. Haven't read it yet.
Okay. It is all about how every experience, from grief to trauma, is being held in the body. And Eastern medicine has known this forever. Acupuncturists can release some of these things. And your body is holding on to those things unless you bring it to consciousness and do something specific to release it. Now, in the mental health field, if you are diagnosed with PTSD and you have a therapist, EMDR is a known, very good, effective way to release that trauma.
Right.
But there's other ways too. We have acupuncturists, we have somatic yoga, any kind of somatic release. The somatic just means body, right? Like you are just letting that pain go, whereas with grief, it's okay to hold on to that relationship.
Right. I want to talk about separating, because we keep saying traumatic grief. I want to talk about separating the trauma from the grief and processing them. But just to sidetrack real quick, because I'm all about pushing resources for PTSD, what do you know about acupuncture and how can you speak on that for like the purpose of treating PTSD? Because I know nothing about it. I was offered it recently and I just don't know anything about it. So I'm sure there's other people who don't.
So there's a range of acupuncture. The science, there's definitely a change in mental health symptoms from receiving acupuncture. If you actually go to a Chinese medicine acupuncturist, which is kind of the far end of the scale, right? We have just like a little bit of ear acupuncture that they, do in some, at your counselor's office to a Chinese medicine. So it really depends on the provider and the practitioner. But Eastern medicine has known all of the theories are around this concept of the body holding on, right? So we know that the liver holds on to anger. The lungs hold on to grief, but the diaphragm holds on to trauma. So when you have grief and trauma, you're probably not taking deep breaths. And acupuncturists can work on trigger points and points to help open those things up. And if you go in with a consciousness of that, then it happens faster, right? If you go in with no consciousness that acupuncture can release some of this emotional trauma that you're holding on to, it just feels like a physical intervention and might help with some back pain or, so it can be just a physical intervention, but it is actually a very powerful way if you can bring the trauma to consciousness.
So you would recommend it for PTSD if you were to pursue a, more far on the Chinese medicine provider, like full bore? Okay.
Well, but even if you just went to a medical provider, just you going in, doing a little bit of research, where's trauma holding in the body? Where are my physical symptoms? If your physical symptoms are you feel a weight in your chest, I can tell you that that's grief.
Wow.
And if you go in, just a little bit of knowledge of yourself, it's going to make that physical intervention work even better.
Yeah, there's two parts to every intervention. It's the actual intervention, and then it's the mindset of the patient receiving the intervention. Because if you think nothing's going to work, I'm screwed up forever, you're going to be screwed up forever and nothing's going to work. So it sounds very woo-wooey, but 100%. It's all mindset. Yeah. It's half mindset, half intervention. But let's cycle back. How do we start to identify trauma versus grief and then process the trauma so that we can experience the grief in a healthy way?
Well, first, are you ready? And I know you are, but let's talk about the listeners. I know lots of veterans that I know personally. They even know what I do, and they won't talk to me.
Yeah, for sure. So what does being ready look like?
Yeah. Acknowledging that you can get better. So there's two things that happen. The fear of losing the service-connected disability, right? Which I don't think you will.
Oh, like if you get better, you're no longer – okay, I understand.
So take that out of the equation. Who cares? Make it look good on paper, whatever. But you yourself, you can actually get better.
Right.
It might take some personal resources and decisions, I don't know if acupuncture is offered to everyone, right, as part of a VA. I don't know. Is it?
I believe so.
Okay.
Yeah, I think I'm not sure the process, but I was offered it through my VA counselor. So
okay.
Yeah.
Perfect. So that's exciting to hear that they're offering those kinds of things, right? And but you may have to do some of your own research. Like my whole thing is we are responsible for our own mental health journey, right? And oftentimes, even as a practitioner and one with lots of experience, people come to me with a mindset of fix me. And I can't fix anyone, right? I can help them on a journey. I can, tell them what I see. Like, oh, I see trauma in you, right? Or I see this is how your trauma is impacting you. But if they're not ready to acknowledge what I'm saying, it means nothing, right? So when I say ready, it's that shift of mindset to I can be a better person. I can get better. Obviously, if you've lost your leg, you're not going to regrow a leg, right? But so there's, being realistic about that. And the journey is often slow, right? When my son died in 2016, in 2021, which was 5 years later, and this is with active grieving, I could confidently say, I know how to grieve and I'm doing it right? And then my daughter dies, right? So life is still going to happen to you. And, I could have just said, oh, I give up. Like, this is too much for any one person, right? So that mindset of not giving up, that you can get better, but it's actually your responsibility to figure out what works.
Right. Yeah. If we talk about beliefs just for a second, I think as we grow older, we can choose to just reaffirm our own beliefs, whether they're good or bad. Bad beliefs just kind of compounding over time become worse. But I think, the beauty of life is you can just hold on to a belief lightly. And when you find a new belief that you resonate with, kind of let that one go or let some of it go and adopt this new belief. So I think in keeping with the theme of healing and grieving, if we understand and go into it and become ready, like you're saying, to believe something new, that I am healing, I am growing, I am overcoming, I think that's the mindset you need to go into it.
I love that. And I'm going to steal that analogy holding it lightly, right? Have a belief system. And this, we talked a little bit about this, but talking about the spiritual conflict that happens when you lose somebody in traumatic grief. I believed in a, single God that loved me and protected me. And I prayed for my children for many years. And then for them to die, how can I possibly believe in a loving, protective God, right? And so I had to go through this spiritual conflict because I was holding on to this belief system that wasn't my reality.
Right.
And if we could learn to hold on to those things lightly, like you said, it would make change easier. Because life is change. Grief is change. Trauma is change. It changed you. Accept that. It changed you. And what can you be holding on to lightly so that you can experience the change in a positive way?
Yeah, it's not easy to do. It's a complete mindset shift, but I think, not to get too sidetracked, but like holding on to beliefs is kind of a egotistical thing. Like we don't want to be wrong no matter what it is. So like we don't want to change our belief. Like I don't want to be wrong. What do you mean? So we just believe the same thing forever. And I feel like the longer you do that, the more of a disservice it does to you. Because I probably still do have a lot of flawed beliefs that I adopted, in my childhood or early days in the military. But to this day, like to this conversation, I'm changing my belief system based on.
But it's beautiful what you said about holding on to softly, because we don't want to let go of some of those things, the things that family and the things that I learned. But if we could just hold on to them lightly instead of saying we have to let them go, would be. And we live in a world, not just the American culture, but if you think of all of the problems in the world, is because somebody's holding on to a very rigid belief system. 100%.
100%. I'm really passionate about the whole belief idea right now. I'm getting pretty into it in my normal life. But so let's say we're ready. We understand that we need to go into this ready to learn a new belief system. We're holding on to our current beliefs lightly. We're ready to process our trauma and grieve properly. How do we start to process those traumas?
So I have a whole thing that I call the Mentally Strong Method. But one activity that you can do just at home, get 3x5 cards. Write down, every friend that you lost on a separate card. Write down all the positive things about that person. And then on another card, write the experience in which they died and the way in which they died. And then you have this physical separation, right? And I just did this the other morning because the holidays are coming. My daughter died just 10 days before Christmas. And so, it's all coming to the surface. And I wrote down on a card, I started with I miss you, Maya. And then I wrote some things that, because in my spiritual journey, I've been able to kind of connect with her and some of the things that she has told me. And then on another card, I wrote the things I was angry about. And it actually was 2 or 3 cards by the time I was done. But,
right.
And I took those cards with the negative things, and I've been working with a lot of somatic stuff, so this is not the only thing you do. But I took those cards with the negative things, and I was able to get it out. And I go, okay, this is trauma, this is anger, these things are not serving me. I'm holding on to these things. And I put them in the fire. I have this tong that I hold into my fire in my house, and I let it burn. And then I took the card that said, I miss you, Maya, and I held onto it, put it in my pocket, and kept it for 3 days straight, just holding on to it, right? That's just a visual way to separate these things. I've also done things like brain spotting, which is
I'm familiar.
You're familiar with brain spotting. So I've done some actual techniques.
Go ahead and explain it from your point of view.
So a lot of people have heard of EMDR. EMDR is great. The problem with EMDR is it takes often a year or more. Each individual trauma has to be separately processed. With brain spotting, we can actually just assess where you're holding on to the trauma now, and in one session release a lot of things. And the first time I did brain spotting, the day I was standing on the riverbank waiting for them to bring up my son's body who had drowned is what came up, as the intense emotion. And I just looked at this spot for maybe 10 minutes until the energy of that went away. And then the weeks later, I actually felt an unraveling of the spiritual conflict, because that's when the spiritual conflict started, right? I was this good, Christian person that, followed all the rules that I was supposed to follow. And at that moment, my husband was, with me praying for him to be alive. And I'm a nurse. I knew he was already dead, right? That is when I no longer trusted God. Right? And so the weeks after that, I was able to unravel that over probably 2 weeks. I felt the therapeutic effect of that one brain spotting over 2 weeks of just unraveling that.
Mm-hmm. And my experience with brain spotting is I sit with a counselor, and he kind of has this tool, or he might even use his finger, and we're trying to process an emotion. The whole trick is the emotion involved with the event. Mm-hmm. Wow, I'm just making all kinds of connections here. So brain spotting is you're identifying the emotion attached to the trauma. So we're grieving instead of processing the trauma through brain spotting. Is that accurate?
Well, what you're actually doing is releasing the trauma so that you can respect the grief.
The emotion. Oh, wow.
Yeah.
Okay.
It's because it got all enmeshed, right? And I still miss Johnny. It's still very sad to tell that story, to think about those things. But the spiritual conflict and the trauma that hurt me that day got unraveled.
Wow. Yeah.
And that's what I mean by separating that, right? But grief, it's okay to hold on to, but not the trauma associated with that grief.
Right. Yeah, wow, this is making a whole lot of sense to me. But yeah, brain spotting. So I've sat with a counselor and they'll hold this up and let's say we're talking about losing a friend. You imagine losing that friend and then you follow this object, or you can do it on your own, just kind of look all in your field of view. And when you start to feel that emotion increase or get more specific in an area of your body, you stare at that place. And now you're forcing your brain to feel that for a prolonged period of time. It's almost like a form of exposure therapy. I've also done it and seen it done in the other way, expansion brain spotting. I don't know if you're familiar with that at all, but now you're thinking about a goal or an end state or an emotion that you feel when you've achieved your goal, and now you're doing expansion brain spotting.
Yeah.
I've done it both ways. I'm a huge advocate of it. I just think it's very, not common. So
Well, and I love it because it's empowering. You can, like you said, you could find, once you've done a few sessions, you can actually learn in your brain where you look when it's trauma.
Yeah.
And you can learn to do it on yourself. You don't have to, it doesn't have to be guided. And that's I'm all about empowering people to take ownership and responsibility for their mental health journey. And that's how we're going to get better. If we go in with this mindset that brain spotting is going to fix me or EMDR is going to fix me,
Right.
It's not that specific technique. It's the mindset of knowing that you can get better. But I love brain spotting because you can learn to do it yourself.
For sure.
Yeah.
You could even do it. Like I do it all the time. I don't even do it with my counselor anymore because I was like, I actually want to talk to you while I'm here. And I can do that on my own at home. I do it while I'm driving sometimes. Then I'll just be like zoned out.
Yeah, I don't know if that's safe.
No, probably not. But
do you have a self-driving car?
No. But if I'm just like, it's almost like it progresses, brain spotting progresses. Like if you just have a thought or maybe you're feeling something from the past or you're thinking about the future, just sit in that for a minute. Whatever you're doing, whatever you're looking at, just sit in it for a second and feel it. And I just think that's why it's important.
Yeah. And we live in a culture that we do not want to feel pain,
Right.
whether it's physical pain or emotional pain.
Right.
So physical pain, just give me a pain pill. I don't want to feel this pain. Emotional pain, I don't want to feel this pain. And so we put it aside. We have to feel it. That's what I call controlled grief. Like I actually, when I feel myself getting dysregulated, I will either do something like a brain spotting or I do somatic yoga, I do some other things. Or I will say, okay, this is controlled grief time. I have a room in my house that has all my kids' toys and their stuffed animals and their old blankets. And I just go in there and I get out a photo book and I start looking at pictures and I bring up the emotion that I've been suppressing so that, and the more we do that, the less often we have to do it, right? So when you think about your friend that you lost, right, we often don't look at those pictures anymore because they're gone, right? I challenge you to bring out those pictures and look at them. It's the same as the brain spotting, but now we're saying, I am so blessed to have met this person, to have had this person in my life. And this has been my journey too. And I've also done psychedelics. I've done ketamine and ayahuasca. I mean, I've been through a lot of trauma, so I had to try everything.
Sure.
But I remember in my ayahuasca journey, it was 2 nights straight. The first night felt nothing.
What was the setting of this, just to kind of paint a picture?
So I went out of the country. It was a ceremony, like a South American ceremony for ayahuasca. It was an individual practice. People can go and do group practices.
Right. And I'm all for talking about, alternate medicine. I just wanted to make sure it's not like you're doing ketamine in an alley and you're healed. You know what I mean? Like it's very structured and professional.
Yes. And I will say that psychedelic medicine is a once or twice in a lifetime thing. It is not something you do on a regular basis. And that is, I'm adamant about that. This is one of my fears. And because this is what's happened with cannabis. Cannabis does have very therapeutic pieces to it, but now people are addicted and abusing it.
Right. And
we're calling it medicine that you're not really using as medicine.
Yeah, 100%.
Right?
Yeah,
and I'm scared of that happening with psychedelics as well.
Psychedelics, it's even worse. Like, I feel like someone could smoke weed all day and you might not notice. But if someone's like on psychedelics every weekend, like, we start talking about changing neuroplasticity, which I really don't even know what it means. But like, if you're changing the elasticity of your brain and creating new neural pathways, okay, that could be good, but that could be bad. So like what poor habits do you have while doing these psychedelics that you're now enforcing, you know, and you're chasing the dragon.
Yeah.
You know, if you did it to solve an issue, you have a new outlook on life, implement it. You don't need to keep doing it, but I want to hear your experience.
Yeah. Once or twice in a lifetime is appropriate, and not everybody has a great experience.
Right.
So I actually did not have a great experience with ayahuasca.
I have no experience.
So the second night, in an attempt to actually allow me to experience it, they gave me like triple the dose, and I felt physically ill, like throwing up, physically ill. And I remember sitting there going, I did this to myself. Like I made this choice to go and do ayahuasca, and I did this to myself. But what happened in the 2-week integration after was a realization that if God, universe, spiritual, whatever, were to ask me, 55 years ago before I was born, hey, you're going to be born, you're going to have these children, you're going to lose these children. Do you still want to go? And I would say yes.
Wow.
And that is grief versus trauma, right? Grief is saying, I am so blessed that I would do it again to have had that person in my life. And, but I got to let go of the trauma piece of it, right? That's the grief that you're allowed to hold on to. Yeah, it hurts. It hurts. I'm choking up a little bit now, right? But that is 100% authentic for me, right? And so it's about going, and I don't think I, needed ayahuasca to figure that out. But some people want, talk about that all the time. They want to experience it for, these great things. It's all over the news. Google searches. It's okay to try it in a safe environment, but the expectation that it's not going to fix you. It's may or may not be part of your journey, but it is not going to fix you.
It's another tool. Tools don't always work. You have to get other tools.
Yep.
I want to ask you this question. This is kind of just, like I told you before we started recording, I'm kind of on this spiritual journey. I'm just trying to understand. What do I believe? Like, what do I believe is going on? Is it God? Is it Christianity? Is it this? Is it that? Like, there's so many beliefs. I feel like this is a never ending process, but a question, and this is motivated by, your ayahuasca experience, processing that loss. Do you believe that we're on a timeline and everything is going to happen when it's supposed to happen?
I think that there is no way for us in our finite ability to comprehend what reality is.
100%, yeah.
And so I think that there are experiences in my life, like losing my children, that I've been able to reconcile that there was nothing I could have done to change this. Like it was going to happen anyway. It was predetermined. But it's also a scary belief to think it's all preordained and what's the point of doing anything? Like I don't think that's our reality either. And so I think we have to be careful of the beliefs that we hold on to and how they impact how we live this life.
Right.
I do believe strongly that this is not the end, and it's not just because of I know it to be true, right? And this is why I encourage people on their own spiritual journey, because Carl Jung, the famous psychologist, right? Somebody asked him, after all of this research on the psychology of people, do you still believe in God? And he said, I used to believe in God. Now I know God, right? And I don't think it matters what you call God, right? Like that's a comfortable word for me, right? It's but I think we get hung up in the word in which we're using. It is in our soul. Our soul knows that this is not all there is. And so, I talk about this a little bit, like with Eastern religion, it's about going inward, right? And in Western, it's like this, God up above, right? The inward soul knows what this eternity thing is, but we have a human limitation to how we can experience it.
Yeah. When you say God, you're quantifying it. We used that word before, but I feel like when you start to quantify stuff, you start to lose touch with what it actually is. God is so much bigger than what it might mean in Western.
The word God can be a trigger for a lot of people, a trauma in and of itself. Right? And especially the way it's often, portrayed. Like if you just, and this was the struggle that I had to work through of, if you just do the right things, God will protect you. And from a worldly standpoint, I was doing all of the right things.
Right.
And so in the Mentally Strong Method, we talk about spiritual conflict, and I think so many people have a spiritual conflict, and that to me is defined as not willing to investigate what they believe. Right? Not whether they have a belief system. And even those with a very rigid belief system, I challenge you to hold lightly.
Yeah, for sure.
Because I think those things are often communicated in a way that a human brain can understand. But the reality of it is so much bigger. So I was this, strong Christian, born again Christian, and I lost my first son, and then all of this medical trauma, and then I lost Reggie. And after Reggie's death, he came to me. My son Reggie came to me after his death, and he said, "Mama, you think you're so smart. You have no idea." Just talking about the vastness of eternity. And in my human, finite, holding on to strong beliefs, I tried to communicate that in a way that was acceptable to Christians. And then when I lost my daughter, I'm like, no, I've got to know for sure. And I have been, my daughter, one of the first things that she said to me after her passing, and now I know I'm actually communicating with them, and not to be kooky, right? But when you have gone through this type of trauma, it allows you to throw away those belief systems and start fresh. And she said, time and space is a human limitation. It's not real.
So that question, which kind of sparked this whole segue, if you knew you were going to lose your children, would you do it again? You were able to say yes. How are you able to say it with such confidence now?
Because what would life be like without having had them at all?
Yeah, it's hard to comprehend.
Yeah, absolutely. They made me who I am. And another thing that my daughter has said to me is, she said, Reggie's purpose was to get you to a place, and that's a physical place and a emotional, spiritual place. Because physically, he brought me to Colorado to try to save him with cannabis. Emotionally, he got me to a place to not hold on to those belief systems so strongly. And then, so Reggie's purpose was to get you to a place, and mine is to stay with you. And that's, my new reality, right? It turned, you will see your friend again. And, but what makes grief and trauma in the context of war and reintegration so hard is, as you go on this journey, you begin to maybe not believe what you were fighting for.
Right.
Right?
Yeah, I could talk about that.
I mean, you were open. I mean, everybody has a different experience, but you have an experience that most young Americans have no clue, of different cultures, and, why are we there fighting? Probably not what we're being told, right? You don't realize these things until you start trying to work on yourself, trying to figure, why am I so angry? well, I just sacrificed not just time, but mental anguish and loss of a friend. And now I come home to a family that's falling apart, and I can't be, a great father because I'm struggling, with these things. And then, talk about belief systems and holding on to political sides. And there's just, if we could hold on to those belief systems. See, you taught me something today.
I'm a radical independent when it comes to politics. But I could talk on that real quick. I deployed twice to Afghanistan. Once in 2015, how old was I? Early 20s. And then once in 2021, I was 30. And my perspective going into each deployment was like 180 degrees different. When I went there in 2015, this is a longer deployment. I thought everyone there was bad. I was like, we're going here because everyone is bad. And that's what I thought, like literally.
Yeah.
I was 23. Like all I cared about was lifting weights and shooting guns. So I was like, we're going here to wreak havoc. And that just was a very flawed outlook because I went there in 2021, given I had a different, more mature job. I was a Green Beret at the time. And I met a lot of really awesome people, Afghans specifically.
Yeah.
Because of the job I was working, I got to interact with a lot of them, like hundreds of them. And I got to meet a lot of them on a very personal level. A lot of them had been working for the U.S. government for decades. And this 2021 deployment was when it was all shutting down. We were the last SF groups there, or last SF companies there. And it was an emotional time there. It was a very emotional time there for everybody.
And that's grief too, having to leave people who you knew were good people into the hands of a government that you knew would not treat them well.
Yeah, 100%.
Like that's grief. Like, so, we talk about collective grief too. Like grief is not just when you lose someone that dies. It's when you lose a belief system.
Yeah.
It's when you lose hope that there's good going to come out of this, right? We hopefully go into war with the intention of a good, better world, right? And then to have to leave that knowing that that's not what happened, that's grief also.
Yeah, it's hard. But yeah, that's what I mean. You got to hold on to it lightly. So like when I went in 2021, I changed my perspective within days of being there because I started meeting all these people. I was transferring with the unit that was leaving. He was introducing me to all these people. I'm like, these are awesome people. And I just thought, my 2015 deployment, how skewed my perspective was. And, there was a lot of good people there, but, there were times 4 months of going to the same green bean coffee and meeting the same guy. And he later gets rolled up as he was tied to Taliban and moving homemade explosives onto Kandahar airfield. So it's like, I have some trust issues too. When you have a suspicion, and now I just feel like I'm always right. But, my perspective was completely changed. And by no means do I think everyone in Afghanistan is good, but I definitely know not everyone is bad. So that is grieving, I guess, huh?
Yeah. And it's complicated. Right? And we try to simplify things, but life is complicated. Your mental health journey is complicated, and compartmentalizing does not work long term. It works in war. You need to have the ability to compartmentalize, right? But this is why the tragedy happens when you come home.
Right.
Because in war, it works. You need to, you can't feel all these things in the midst of protecting yourself and your mission, right? But when you come home and it's, coming to the surface, the compartmentalizing doesn't work long term.
So tell me about this perspective, because a lot of people can relate to this. You leave for a deployment, you have a family, and they see you how you are now. And then you deploy for 6 to 12 months, and you come home and you feel like you're the same person, but your family members have a different perspective on you because you have changed. Your beliefs have probably changed. Your traumatic experience has probably increased.
Yeah.
So how do you understand both sides of perspective here, both the family and the soldier who deployed and came home?
Yeah. I want to challenge veterans to be open and honest. And I think, and I can give a perfect example of this. Someone who diagnosed PTSD, knows he has it, but doesn't really feel like any of the things that have been offered have been helpful, and so doesn't do anything new. Functions, working, relationship, but clearly there's a lot of anxiety that he's holding on to, and it's evident in different areas of his life. He's been in a relationship for a really long time, and this person knew that he had been to war, but someone who's never been to war just thinks, okay, you lost, you have this trauma, you have this grief. And just recently, after several years in this relationship, he was honest about the experience and how there were people who were in service that did not have the right intent, right? There was something about this situation where he had lost several friends that was something he felt like he could not share.
Right.
And after several years sharing that created a whole new perspective for the partner to see why it was so intense. Like being honest, not just about, because people are scared to ask too. They're not going to ask, what actually happened. And, maybe you'll say, there was an IED and I lost 2 friends. Well, now you've scared your partner and they're not going to ask any more questions, right? A fear of being a trigger. I challenge the partner. It's okay to ask more questions. It's okay to let them tell you those stories because they're going to come out in anger, irritability. They're going to impact your relationship. Try to understand why they changed because you're not going to get back the person that left. Mm-hmm. And that could be a good thing. I hope you feel like a smarter, wiser man to have experienced what you've experienced, right? I mean, if you think about the privilege of the American culture, you're wiser to have experienced these things, even though they were horrible and they were trauma. And you are wiser figuring out how to process them and move forward and be a better person,
For sure.
right? And so embrace the change because we don't like change, but I'm sorry. Grief and trauma change you, and you can't go back. You can be a better person, but you cannot go back to who you were before.
Right. Yeah, that's a good explanation.
Yeah.
I want to ask you one more question, and then I want to hear about the work you do today. Mm-hmm. And this is just a made-up question based on what you just said. Why is anger the most prevalent emotion when we start to feel this grief? Mm-hmm. Like anger is just the end-all, be-all. I'm feeling something. I'm going to turn off to the world and just be angry
it's
at everyone.
Protective.
Yeah, it's protective. We don't want to look.
It's like a shield. I imagine it's like a shield. Like, I can't do this, and so therefore I'm going to treat you bad or I'm going to treat somebody bad. I'm going to blame somebody else. And if you have insight, anger is always a secondary emotion, and this is hard for people to hear.
What do you mean secondary?
There's something under it.
Okay.
It is a protective, there's always something under it.
Shame, sadness, fear.
Any of those things. And, people say, there's righteous anger. That's injustice though, right? And you likely have experienced some injustice by, being in a combat traumatic situation, right? You've experienced some sort of injustice. So there could be righteous anger, right? However, it's still secondary. That injustice is pain. That injustice could have some grief in it. It could have some trauma in it. And as you learn to process those things, the anger will decrease.
Right.
So, I sometimes, people get on me about this, like anger management classes don't work, right? It's not about controlling your anger. It's about having insight as to what is underneath it.
Right.
And working through that because that whatever's underneath that anger is a fire. And when new things happen, because life is hard, more stuff is going to happen. When new things happen, it's like putting, gas on that fire, right? And anger is the easiest way to release some of that pressure.
Yeah.
It's kind of like if you had a teapot or boiling water and you're trying to hold down the pot. You've got to figure out what's underneath that anger and whether you think it's righteous or not, there's an emotion that you're not processing that's under that anger.
Yeah, I wanted to ask you that because I've understood this recently. I've been going to counseling for close to 4 years now, very consistently, and I was an angry person. There's people in my past who would gladly tell you how angry I used to be. But I've seen it in a different light. And my old therapist, when I was still active duty, when she told me this, I broke down crying because my reality was shattered. I just thought I was an angry person. And by angry, I mean, just out of proportion, road rage, yelling at people, just stupid anger, nothing out of proportion. But when she told me that, it made sense. It made perfect sense. And I was able to identify exactly what I was feeling. It was sadness. It was shame. It was grief. It was all these things that I had been shoving down in the military, both from training experiences to 3 deployments to losing family, losing friends. I was just really angry because I was feeling a lot of things that weren't anger. And that's my self-defense emotion. And that's all of our self-defense emotion. And we talk about the veteran community, anger gets brought up, the angry, salty veterans. But ever since this perspective change, this belief change, is I see angry people differently. And it's not like I see an angry person in public screaming at a cashier and I'm like, oh, I feel bad for them. But I understand that they don't mean it. Probably. Because like you said, there's injustice, anger. There's other reasons to actually be angry. Yeah. But for the mundane, everyday little bit of anger, I have sympathy. Yeah. And I understand this person probably just needs a conversation with someone who will listen to talk about it and process it.
And I want to bring light to what you said of being in therapy for 4 years and that this is a journey. And now that you've been through this for 4 years, you realize now that it's forever. Right. It's a life journey of self-discovery and self-development and improving yourself. I just encourage the veterans to take that first step. But your first several sessions are not going to feel great. Right.
No, for sure. No. They shouldn't.
And so, but having that insight and back to the willingness, it's a journey. You're not going to go for 12 sessions and get fixed, but you might go for 12 sessions and realize, I can do this. I've got some more tools. I'm going to do, these different things.
Yeah. Last thing I'll say, and then I do want to hear about your current work. But when we leave the military, you can probably relate to this. We kind of lose our purpose in a way. We lose the purpose we had. It doesn't mean we lose purpose altogether. But if we can somehow, we still need a job, we still need income, we still need to do stuff. But if your purpose can be to take care of yourself, you're no longer required to just be this selfless soldier ready to risk it all in any single minute of any day. So if you can wake up, start with yourself, and every evening end with yourself and just refill your cup at the beginning and end of every day. You can do this in many different ways. I have a pretty extensive morning routine involving getting calories, sunlight, stretching, meditating, and I end my day with some of those similar acts. And that has been absolutely life-changing. And it sounds so simple. It sounds so stupid, but if your
purpose— Do you have kids yet?
No kids.
They'll disrupt that whole little routine.
A lot of dogs.
If you ever end up having kids, it'll disrupt that.
For sure.
That routine. But absolutely, one of the things that I realized as being a mother and that being my sole purpose is I didn't know what filled my cup. I don't think we teach that. We don't have 20-year-olds going, I know what fills my cup. No, because your cup's full. And it's not until it starts getting depleted that, problems start to happen or inability to process things or to identify your emotions. So I think it's important to know what fills your cup.
Right.
And it's not the same for everyone. People talk about self-care and they'll, give examples of self-care, but maybe that doesn't fill your cup. I remember for years when people would be like, oh, well, go get your nails done. To me, that's just another responsibility. I'm doing it because someone else thinks my nails should look good.
It's an expense.
Right? And it's expense for what? That's not self-care for me.
Right.
People would say, oh, you got to go to the gym and lift weights. That's not self-care for me. That might be self-care for you, right? And so it's very individual and owning that, figuring it out and owning do you go to the gym and feel like, oh, this is something I do because they say I should do it, right? But I really don't feel any better when I leave. It's probably not filling your cup.
Yeah.
But there is some sort of movement or activity that will fill your cup.
Right.
And so figuring out those things rather than just listening to what people say you should do.
And that's what makes it exciting. Like it's a journey to figure out what you love,
right?
What your beliefs are, what fills your cup. Like it's a beautiful thing.
Yeah. Sounds like dogs fill your cup.
I have a lot of things. Being outside, camping, hiking, dirt biking, dogs.
Yeah.
I make music. I make art. I'm a creator. I create stuff. I think that's the secret. Like we were saying before, you know, it's creating stuff. We were put here to create. We need to create stuff.
But I can give you a perfect example. Like, so for me, we've always had at least one dog and one cat the whole time I'm raising my 7 kids, right? To me, they didn't fill my cup. They were another responsibility, right? And so, but to someone else, they fill their cup. And so making sure that what you say is filling your cup is actually filling your cup, and you're not just doing it because someone else says that that's what.
Yeah.
I had someone recently, she lost her son, 3-year-old son, and somebody gave her a puppy. She didn't want the damn puppy. And it's really a burden for her right now.
Right.
And so don't assume what's going to fill someone else's cup either. Yeah.
This is relevant to like medicine, all kinds of stuff, like medications, things like that. This is a great conversation. I want to ask you more questions. From a mother's perspective, we're talking about purpose, and I just want to kind of tie this into motherhood. When a mother's purpose, their entire purpose becomes their children, is that a slippery slope to go down?
It's very unhealthy.
And
but
what does that look like?
We do it, and it's real easy for me to retrospectively say it's not healthy.
For sure.
But I did it. So the thing that I tell mothers is that one thing: figure out what fills your cup.
Other than your kids.
Other than your kids, right? Like there's got to be something else. And, you know, you may only have 30 minutes a week to try something new. But once you find that, then you know the source to fill your cup. But we are often running on depletion, and we're not filling our cup. We're expecting our spouse to fill our cup, and that's not. You're actually responsible for filling your own cup if you. Sure. And that's, part of the problem in relationships of the expectation that the other person's going to do that.
Yeah, I think that's where it gets slippery is, I'm not a mother. I never will be. You expect your kids to fill your cup. Like they're going to grow up and be this doctor or lawyer or spaceman or whatever it is. We all have these dreams. I wanted to be a trash man. I'm not a trash man. That'd be cool though to ride on a truck. But like when we expect other beings to fill our cup, we're always going to be let down. Always, 100% of the time. So where'd you go to med school?
So I'm a psychiatric nurse practitioner. I went to Florida International University, got my doctorate at Nova with a healthcare education. So I also teach. So I have a clinic here in town, the Mentally Strong Clinic. It's on Sinton Road between Garden of the Gods and I-25. Probably seen our sign on I-25. We take walk-ins. We take insurance. We take VA, what is it called now? Tri-West. They keep changing the name. For Spravato specifically, but not for medication management. They want to do their medication management in-house. But we take all other insurance, and we do medication management, including ketamine and S-ketamine and EEG neurofeedback. So a comprehensive clinic there. But my passion is teaching. So I have a whole podcast on grief and trauma and how to work through those things. I also have online courses. My grief course is free right now. If you go to mentallystrong.com, press Academy courses, and you can see the grief course is free. We are going to be doing a grief intensive where we teach people how to think through their problems, organize them, and make choices in line with what they want. This is unfortunately a cash-based program because insurance, the way that insurance works, it just doesn't work for intensive type programs.
How did your journey into becoming a doctor start? Like, how did you make that decision to, I'm going to go down this path?
So I've just figured this out recently when you talk about, do you know yourself?
Right.
I've always been like, what's next? What's next? You know, very productive, goal-oriented, type A personality. But I realized that my core of who I am is I care about people and I want to help people, right? And so it started off as 17 years old, an Army medic, right? I knew I wanted to care for people. I knew I wanted to help people. And then, okay, I like this field. I'm going to go into nursing. That's caring and helping. And I was actually working at a juvenile prison when I realized how much of the kids actually had mental health concerns and trauma. And I wanted to be able to help with that. And that made me go for my psychiatric nurse practitioner. And then I was like, yeah, but we need to actually teach mental strength. And then I went for my doctorate.
Okay.
Yeah.
Well, I'll end with this question. What's next for you?
It is this whole traumatic grief expert.
Okay.
This is an area that we are not talking about. And how do you actually process grief? And I'm going to challenge a lot of grief theories and really help. We have a lot of grief that we're holding on to because it's connected to trauma.
Yeah. Well, it's super prevalent in the veteran community specifically, which is why you came on today. So moving forward, we'd love to have you back on, talk about this as you develop these theories, because this is, like you said, it was untouched. It is untouched. And when you came in here before we started recording, I was like, my jaw was dropped. I was like, here, talking to this microphone, this is important. So I appreciate your perspective. I appreciate the work you're doing, both for the veteran community, but for humanity as a whole, understanding grief, traumatic grief, how to compartmentalize step one and process step two, this trauma. So absolutely.
Cool.
Well, thanks for coming on the
Yeah.
Veterans Voice podcast. This was a great conversation.
Yeah.
We'll see you next time.